All right, hello, and this is Alice Shapiro for HIT 154, Introduction to Medical Science. This is the PowerPoint narration for the diseases of the musculoskeletal system and the skin, which of course includes bone, muscles, and skin. So I may divide this into two recordings. We'll see how our time goes. Again, my objectives for you, and we're not going to do everything there is to do about these systems. We don't have time in several lifetimes, but we will define basic terminology. You may need to review some of this. Describe key characteristics of diseases of the muscular skeletal systems and the skin, which of course is the integumentary system. Understand the etiology, signs and symptoms, diagnostic tests, and possible treatments for selected diseases of the systems, and understand some age-related changes of these systems. Here's some diagnostic tests that can be used either for bones, joints, or muscle diseases. As you can see, joint fluid aspiration is important for joint diseases, and microscopic and chemical analysis. Electromyography, which of course is examination of muscles. Myo, remember, means muscle. Biopsy means, of course, taking a sample of living tissue. Diseases of the bone can be infectious diseases, which can come from blood or a fracture, or from the spreading of an adjacent infection. Vitamin and mineral deficiencies could prevent proper formation and maintenance. Bones do atrophy with disuse and fracture. If any of you have ever had a cast on or otherwise immobilized, are aware of that, and can occur spontaneously in certain diseases, and certainly tumors can develop in bone, either benign or malignant. All right, vitamin and mineral deficiencies, these are the key to bone health. Not just calcium, but phosphorus is important as well. Dietary calcium cannot be absorbed from the digestive tract without vitamin D, so therefore vitamin D deficiency can impair bone formation as well. Rickets is a disease of infancy or early childhood, and the bones do not ossify properly, and the bones of a child with this disease are soft and tend to bend. The weight-bearing bones of the body, particularly the femur and also bones of the lower portion of the leg, can become bent, and the sternum or breastbone will project, and bony nodules can form at the ends of ribs or at wrists, ankles, and knees. The skull will be larger and square-looking. The pelvic opening of a girl may narrow and can then lead to later problems in life. Other symptoms include flaccid muscles, delayed teething, and pot belly, which is an indication of malnutrition. It can be prevented with vitamin D fortified milk and sunlight, which converts the inactive form of vitamin D to vitamin D. Here's an X-ray image of a child with rickets. Notice the bowing of the femur and also of the tibia. Osteomalacia is softening or decalcification of the bones in adults. So it's, in a way, it's adult rickets, and same kinds of symptoms. Bones of the vertebral column, legs, and pelvis become particularly susceptible to bending or fracture. Osteomalacia is caused by inadequate dietary vitamin D and deficiency of calcium and or phosphorus. It can be treated, but again, here is the X-ray of a 40-year-old woman with nutritional osteomalacia. Notice how her hips and pelvis have been affected. Osteoporosis literally means porous bone. These bones are susceptible to fracture, and they are very fragile. Weight-bearing bones, particularly the vertebral column and the pelvis, are particularly affected. The compressed vertebra can press on spinal nerves and cause great pain. Fractures are very common in the hip and wrists, and 80% of those affected by osteoporosis are women. The risk factors include being female, advanced age, and having a small frame. Sometimes someone will say, oh, my grandmother tripped and broke her hip. No, probably what happened, unfortunately, is that your grandmother stood up. Her pelvic girdle was so weakened by osteoporosis that caused her to fall. So the break usually precedes the fall. Here is a diagram of what may occur. So I hope we're all sitting up just a little bit straighter as we see this, or standing up taller. Weight-bearing exercises are extremely important in the prevention of osteoporosis. You don't have to have this progression occur. All right, here are some risk factors. You can read them. There is some family history involved, but much of what occurs in osteoporosis can be prevented, or at least can be delayed, or milder case. There is some bone mass loss, but it doesn't have to result in debilitating conditions. All right, here are some of the diagnosis, treatment, and risk factors. Patient history and bone density tests should be taken. Prevention is recommended, and you can see some dietary factors and weight-bearing exercise are important. Smoking and excessive alcohol increase the risk. Early diagnosis is very important. Treatment options include estrogen and other hormones, but again, this would be very necessary to be monitored and regulated by your health practitioner. All right, let's look at diseases of the joint. Arthritis, which includes rheumatoid arthritis, osteoarthritis, gout is the form of arthritis, septic arthritis, and also bursitis, sprains, dislocations, and strains are other diseases of the joint. Let's look at rheumatoid arthritis. It is a systemic disease. It is an autoimmune disease. The joints are often affected on both sides of the body. The pathogenesis or progress of the pathology begins with inflammation of the synovial membrane that lines the joints, particularly the small joints of the hands and feet. The membrane, the synovial membrane, thickens and extends into the joint cavity. Inflammation affects the articular cartilage and causes them to erode. Scar tissue can develop between the bone ends, and this can become calcified and cause a condition called ankylosis, which is a fusion actually of the joints and makes formerly movable joints immovable. Extremely painful. This is a diagram of what can happen. This is from Adam, and I have given credit here. This shows the tibia and the pitted cartilage above, and the inflamed synovial membrane, and this bone, this what looks like pitted cartilage above, as I mentioned, this synovial membrane can become calcified and make the joint immovable. All right, diagnosis of rheumatoid arthritis. The cause is not really known, but it is an autoimmune disease. And here are some ways to identify it. The antiglobin antibodies combine with immunoglobulin in the synovial fluid to form antibody complexes, and then the neutrophils are attracted to this and cause destruction of the joint space. So the body is reacting to itself as if it were foreign, which is the definition really of autoimmune disease. So a balance between exercise and rest is needed. In the acute phase, the joint should be rested because then it is inflamed. Anti-inflammatory medications are effective, again controlled and monitored by a health practitioner. Aspirin and similar drugs are also used to prevent some of the inflammation. So non-steroidal anti-inflammatory drugs are also helpful. They may not stop the disease process, and they do have side effects, steroids themselves, so you need to take those with caution. All right, osteoarthritis, which literally means arthritis of the bones, is the most common type. It may affect only one joint and causes pain and stiffness. Arthritis in the lower back may pinch a spinal nerve and, as you can imagine, cause great pain and debilitation from that. Degeneration occurs at the articular cartilage, and the erosion of the cartilage causes further degeneration and also degeneration of the underlying bone until you have bone rubbing on bone instead of upon its articular cartilage. Treatments: there is no cure. Special exercises, steroids may help. Surgical replacement of a damaged joint, such as the knee joint or the hip joint, may be needed. Here is a diagram, again from Adam, of osteoarthritis in the knee, contrasting a healthy knee joint versus the hypertrophy and spurring of the bone and the erosion of cartilage in osteoarthritis. All right, gout is often called gouty arthritis because it does affect the joints of the feet particularly, especially the big toe, sometimes the wrist and knee, and it can have a sudden onset of an acute attack. The joint has signs of inflammation, and these signs and symptoms can last for many weeks, and after an attack has resolved, has completed, there can be symptom-free periods of 6 months to more than 2 years. So you need microscopic examination of aspirated joint fluid, which reveals needle-like crystals of uric acid. And high serum levels of uric acid is consistent with gout. However, there may not necessarily be high blood levels because some of the uric acid, much of it has crystallized out to form the crystals in the joint. So sometimes x-rays are needed to help to diagnose. Cause is actually unknown, but heredity is a factor, in excess uric acid in the blood, sometimes from overconsumption of high-fat meats, can be a problem. I better go back a couple. I went back too quickly. Various medications can be prescribed. Again, there are major side effects from some of these medications, so obviously a health practitioner must be involved and must help to monitor this condition. All right, here is what the gout could look like. Notice the inflammation, especially in the big toe. The crystals seem to like to congregate in that big toe joint. Very painful condition. All right, we'll stop with bursitis because we're running close to out of time with this particular segment, and I will pick it up after this. An inflammation of the bursa. The bursa are the fluid-filled sacs that reduce friction between layers of muscle. The bursa of the shoulder joint are the most frequently affected. Think about all the movements you do with the shoulders. Treatment includes resting the joint and applying moist heat. Steroids can sometimes be injected to reduce the inflammation. And here is an example of hip bursitis, and you can see where the bursa is located. Again, in between layers of muscle is a common place for the bursa and therefore for bursitis. All right, I'm going to end here, and we will pick up with this age-related diseases of bones in the next PowerPoint, which will be coming up shortly. So I'm going to finish for now. Please note that the entire program, which I will finish in the next narration, is available non-narrated on your Moodle site as I speak. So that's a very good place to review. I will talk to you later.